I can just start maybe with just an introduction of kind of how Satiria came to be in Vermont. So Satiria is a program of Pathways Vermont, and Pathways Vermont was established in 2009. Initially, it was for providing just housing first services in Vermont, and then grew into a variety of other programs. And I want to highlight that because I think that Satiria functions well under the Pathways Vermont umbrella. And we had done a survey a few years back of our staff, and 78% of the staff identified with lived experiences of mental health challenges. And at the time, 17 individuals openly identified with lived experience of hearing voices. So I think that's just worth highlighting the value of lived experience within our agency. And all of our direct service staff are trained in something called intentional peer support, which is based on a model by Chris Hansen and Sherry Mead, who are also from Vermont. And our project, the Satiria project, is based on the original Satiria project by Lauren Mosier in the Bay Area in the 70s. In 2010, we had advocates that were working with Pathways Vermont reach out to the Commissioner of Mental Health, and we were able to start doing a proposal for Satiria Vermont, and we created a legislation requesting a contract for a voluntary 5-bed residence for individuals seeking to avoid or reduce reliance on medication or having an initial episode of psychosis. And then in 2011, Hurricane Irene happened in Vermont. So Hurricane Irene actually flooded the Vermont State Hospital in Waterbury, which gave an opportunity for us to, I think, reevaluate as a state alternative models to mental health supports. So Satiria Vermont opened in 2015. We serve individuals experiencing a first episode of psychosis. We tend to not use that language and instead talk about extreme states or non-consensus reality. At any given time, we can serve 5 individuals in the house. We talk about being a transitional program, so we aim to be around 3 to 6 months, and our average stay is 5.5 months. We're fully funded by the Vermont Department of Mental Health, so we receive an annual grant. We're licensed as a therapeutic community residence, and we serve residents over the age of 18. You have to be 18 in order to be in the Satiria house. I think I would just offer like a more general overview of maybe what that experience sometimes looks like for individuals. We can support people that are in really heightened states, and sometimes we actually have a agreement with the person that we're going to be with them in the community 24/7. So we actually will go with people into the community, and we talk a lot about how people might feel like it's kind of like following somebody, and for us it's not that. It's actually just really wanting to be with somebody through their experience. Sometimes we have folks that might not look both ways before they cross the street, so they're in maybe a more heightened state, so we want to be with them in the community. We sometimes work with folks that are in really withdrawn states, so maybe we're actually bringing the food up to their room. So I just want to say being with can look so different, and I think the beauty of this is that we create individualized service plans. I think Satiria is kind of really what you make it. A few other things I wanted to highlight for successes, I would say, is our transparency. So we actually allow people to access their notes. We have to do at least one note per day for TCR regs, and we actually end up doing more like 3 or 4 notes a day. And folks can actually add notes to their own record. We try to be really collaborative about that process. We actually, prior to COVID, were doing community dinners for former residents to be able to come back. We try to create like a sense of community. We have a lot of just different meetings or opportunities for engagement throughout the week with folks. I would highlight here too, one of the challenges. Our program, our ideal candidate is somebody with no hospitalization history and that's med naive. And I would just say that's very challenging to find in a society that really values the medical model. And additionally, there is a preconception of residential being a step down from a larger system of care. So we're working in the state of Vermont to really get the word out there more, trying to get referrals from emergency rooms. And there's some, for the sake of time, don't need to necessarily go into it, but there's some barriers when somebody ends up in the emergency room to actually coming to us versus being hospitalized. So that's just a challenge that I would say prevents us from sometimes getting kind of that ideal referral. Everyone that works there So for the most part, we have at least 20 folks that work there. We have 2 to 3 staff on per shift, and everyone, for the most part, is employed. We have had like interns or volunteers, but maybe like 3 or 4 in the handful of me being there for a little over 4 years. I did actually create a position for a former resident, so they work there a few times a week and support with dinners in a group. And I think supportive wise, we have, I mentioned the intentional peer support. So we do co-reflections that are offered at least daily at Pathways Vermont. So staff have the opportunity to do a co-reflection with members of our whole agency. All full-time staff get an hour of co-supervision a week. And then we also have a weekly team meeting for all of our staff. So it's 3 hours of designated time to process and get support.
Yeah, and it sounds like it really works. Another thing I was thinking, you spoke earlier on about Pathways Vermont. So presumably that's something when people have spent enough time in the Satiria house, presumably there's support for moving on to appropriate housing if that's what people want to do. And that must make a big difference, I guess.
Yeah, I mean, so actually our Housing First program, a lot of our, the folks that are eligible for that usually have to have a history of homelessness and possibly like a long-term hospitalization history. So often we don't refer to those housing services. Our model is coming from the belief that people have the ability to work through this experience. So ideally they're not going on to consistent, like really intensive supports, and Housing First is a more intensive support. But we do have the Pathways Vermont Community Center, which is currently closed, but we do online Zoom groups. So we have like a Hearing Voices group, we have a Exploring Coming Out of Psych Meds group, Alternatives to Suicide group. So those are groups that people can access through our community center. We also do supportive employment. So we often refer to our supportive employment staff to support folks. So there is a lot of like integration, but not necessarily with the housing piece. I'd love to see some type of like, I don't know, like funding for somebody for 6 months to get into an apartment, after Satiria. So there's a need for that. So we try not to have folks visit the actual site because, we're trying to create a therapeutic community. A home-like environment, but we do meet. I meet with a lot of folks, informally before COVID, like in our admin office. We do a lot of remote outreach right now. I've done a lot of presentations to psychiatrists, to resident psychiatrists up at the University of Vermont. I think there's definitely an interest. I actually get asked the question a lot of like, how would you start a Satiria somewhere else? And that's why I started with highlighting the value of, I think, Pathways Vermont, like having that value from from literally our executive director is so amazing and just shares, very openly about her own personal experiences, and the value of the lived experience really has helped me and supported me in sharing my own lived experiences, using IPS, practicing with mutuality. So I think it's really shifting the larger system, unless you were just going to have kind of Satiria maybe isolated in more of a bubble kind of environment. But I think in that case, you really need funding and support. So I'm grateful that we're supported by the Vermont Department of Health to have Satiria.
Yeah, well, and it obviously works because you're still getting the funding, and they wouldn't keep funding it. Yeah, that's brilliant.
Yeah, Peter and I are collaborating right now of trying to develop some kind of resiliency scale. I would say it's challenging to get quantitative data in some ways, and a lot of the qualitative, we actually have a video project that I'm sure I could share with some folks here. We've been doing video projects of former residents sharing their stories. I think a big part of this is, I'll use myself as an example. Like I deal with anxiety daily, and sometimes multiple times a day. So on a quantitative scale, I might still look like I'm struggling in some ways, but like I have the tools and the resources and the resiliency to know how to navigate that differently. So I think that's the kind of story we're trying to get at with folks now. Like, it's okay if you leave our program Hearing Voices. Like, do you have the tools to navigate that experience? So thank you.
Thank you. Absolutely brilliant. It's been really, really fascinating.